Could taking antacids and PPIs actually be making your reflux worse? Let me tell you why overuse of these common medications could actually be getting in the way of healing from reflux. And if you haven't subscribed yet, make sure to hit the subscribe button and the bell to be notified every time I post a new video. PPIs, or proton pump inhibitors, are prescribed often for acid reflux for both GERD and LPR. This is because they decrease production of acid in the stomach. Prilosec, also called omeprazole, is one of the top 10 most prescribed medications in the US. Okay, so then people with acid reflux make too much stomach acid, right? Well, no, that's actually not that common. These medications are prescribed because when acid and pepsin, which is an enzyme made in the stomach, reflux up into the throat and other areas, they cause tissue damage and pain. But this isn't because there's too much, it's just because they're not staying in the stomach, which is where they belong. A lot of people with GERD feel relief with antacids and PPIs because the stuff that's refluxing up into their throat isn't as acidic anymore, so it doesn't cause so much pain. But a lot of people with LPR, or silent reflux, don't get much relief from antacids and PPIs, which can be very frustrating and confusing. Have you taken antacids or a PPI for reflux? Let me know in the comments below if they made a difference in your case. So if antacids and PPIs decrease the production of acid in the stomach, how can that actually make reflux work? Well, first, one of the main jobs of gastric juices like acid is to kill off pathogens like bacteria and viruses. So if the medications create a low acid environment in the stomach, that's going to increase your risk of infections and bacterial overgrowths. And these bacterial overgrowths can be one of the causes or at least contributing factors to reflux. Second, the FDA recommends not using PPIs for longer than 4 to 8 weeks. The idea is if you take them for this 4 to 8 week time period, that gives the irritated tissues of the throat and other areas a chance to heal by decreasing their exposure to the acid. If you continue taking them longer than this, they're just covering up the problem, not actually fixing it. This means that the true causes of reflux are being overlooked or ignored, and the problem will just continue. And third, poor digestion of proteins. So stomach acid activates enzymes in the stomach that break protein down into amino acids. These amino acids then travel into the small intestine to be absorbed. So if stomach acid levels are too low, protein won't be digested very well. And poor protein digestion can affect liver function, and poor liver function is associated with an increased risk of acid reflux or GERD. Some other things to keep in mind with long-term use of PPIs is the risk of decreased nutrient and vitamin absorption, particularly B12, magnesium, and calcium. The FDA issued safety announcements about the risk for increased fractures, low magnesium, and increased infections with C. diff with long-term use, which generally means 1 year or longer. That said, PPIs do have their place, mainly as a short-term option to help heal from reflux esophagitis, or inflammation of the esophagus, while the causes of reflux are being looked into and addressed. But you should at least be able to make an informed decision, knowing the pros and cons of a medication before you decide to take it. So if you're currently taking PPIs for reflux, you may want to chat with your doctor about what else you can do. As always, this information is not medical advice, and it doesn't take the place of a personalized plan with your own trusted provider. But most doctors will be happy to work with you to gradually wean off PPIs if that's your goal. And if they aren't, then you may want to find someone who respects your health goals and your medical autonomy. There are actually a lot of things you can do to help yourself heal from reflux, and one of those is improving your digestion. So if you haven't already, download my quick start guide to reflux and digestion. I'll put the link in the description below. And if you want to know more about some of the causes of reflux, check out this video next.